health maintenance organizations (HMOs), and preferred provider organizations (PPOs) are types of managed care plans that are commonly offered by employers as part of their employee health benefits package. Here are some key concepts to understand about HMOs and PPOs. HMOs. HMOs typically require you to choose a primary care physician (PCP), who coordinates your healthcare and refers you to specialists as needed. HMOs typically have a limited network of healthcare providers that you can see for covered services. HMOs generally have lower out-of-pocket costs for covered services, but less flexibility in terms of which providers you can see. PPOs. PPOs do not require you to choose a PCP or get referrals to see specialists. PPOs typically have a wider network of healthcare providers that you can see for covered services, but you may pay more out-of-pocket costs if you see providers outside of the network. PPOs generally have higher out-of-pocket costs for covered services, but more flexibility in terms of which providers you can see. HMOs. HMOs typically require you to choose a primary care physician (PCP), who coordinates your healthcare and refers you to specialists as needed. HMOs typically have a limited network of healthcare providers that you can see for covered services. HMOs generally have lower out-of-pocket costs for covered services, but less flexibility in terms of which providers you can see. Here are some key differences between the two. Network of providers. HMOs typically have a smaller network of healthcare providers that their members can see. This means that members may need to choose a primary care physician who coordinates their care, and may need to get a referral from this physician in order to see a specialist. PPOs, on the other hand, typically have a larger network of providers, and allow members to see any provider within that network without the need for a referral. Out-of-network coverage. HMOs generally do not cover services from providers outside of their network, except in cases of emergency. PPOs, on the other hand, typically offer some coverage for out-of-network services, although this coverage may be limited and may require the member to pay a higher out-of-pocket cost. Cost sharing. Both HMOs and PPOs require members to pay a portion of the cost of their healthcare services, but the specific cost-sharing arrangements can differ between the two types of plans. For example, HMOs may have lower deductibles and copays, but may require members to pay a larger share of the cost of out-of-network services. PPOs may have higher deductibles and copays, but may offer more flexibility in terms of the providers that members can see.